The effect of ibuprofen sustained release oral pre-medication on intraoperative pain and post-operative pain, a randomized clinical trial. Although nerve block is the standardized injection technique for pulpal anesthesia in mandibular molars, it has a failure rate ranging between 43% and 83%. Buccal infiltration only produces profound anesthesia with a success rate of 32% and 67% when administered with lidocaine, 57 to 92% when administered with articaine, even when a block is not administered. There are many strategies suggested to improve the anesthetic efficacy and reduce the incidence of post-operative pain. Long-acting formulation of ibuprofen offers sustained pain relief in surgical pain model. It is assumed that the efficacy of the longer-acting formulation of ibuprofen demonstrated in surgical pain model would extend to other types of persistent pain. The aim of this study was to evaluate the effect of ibuprofen sustained release oral pre-medication on the efficacy of buccal infiltration anesthesia, intraoperative pain, and post-operative pain after single-visit root canal treatment in mandibular molar teeth with acute irreversible pulpitis and apical periodontitis. This study is a single-center, randomized, controlled, parallel group, double-blind clinical trial with a 2-day follow-up. The patients were recruited from the outpatient clinic of the Department of Endodontics from October 2021 to June 2022. Systemically healthy patients, males and females aged between 18 and 45, having mandibular first or second molars with symptomatic irreversible pulpitis and apical periodontitis showing normal periapical radiographic appearance or slight widening in lamina dura and positive response to percussion were included. The sample size was calculated based on a previous study by Madani and concluded a total sample of 42 patients and 21 patient per group is needed. This number was to be increased to a sample size of 30 subjects per group to compensate for any loss during follow-up. For the randomization, a random sequence was generated by computer software. The assistant was the one who generated the random sequence and assigned the participants to the intervention or control group, and was the only one who knew which number was intervention and which was placebo. Patients in the intervention group received 800 mg ibuprofen sustained release tablet, while those in the control group were given a transparent placebo capsule that contained glucose. The tooth was anesthetized using buccal infiltration technique by 2 cartridges of 4% articaine with adrenaline. Pain was assessed using modified VAS score preoperatively, intraoperatively, and postoperatively at 6, 24, and 48 hours. For intraoperative assessment, mild pain of 0 to 3 was considered success of anesthesia, while moderate and severe pain were considered failure. 400 mg ibuprofen was prescribed per need, but patients instructed not to take it before 6 hours of procedure. For statistical analysis, continuous data were presented as mean, standard deviation, median, minimum, maximum values, and 95% confidence interval, and were analyzed using Mann-Whitney test. Categorical data were presented as frequencies and percentages, and were analyzed using chi-square test. For the results, in terms of anesthetic efficacy, the group sustained release showed a statistically significant higher anesthetic success rate of 73% compared to 46% in placebo group. The mean VAS score of intraoperative pain intensity were 2.8 in the sustained release group and 4.5 in the placebo group. There was a significant difference between the two groups. In terms of post-operative pain intensity, there was a statistically significant difference between two groups at 6 and 48 hours, while there was no statistically significant difference at 42 hours, at 24 hours. In terms of analgesic intake, 26% in the sustained release group needed rescue analgesics, while within the control group 60% needed analgesics. There was a significant difference between the two groups. In conclusion, pre-medication by a single oral dose of ibuprofen sustained release significantly improved the efficacy of primary buccal infiltration anesthesia in mandibular molars with symptomatic irreversible pulpitis and apical periodontitis, and significantly decreased post-operative pain intensity at 6 and 48 hours and the need for rescue medication.